I'm Dr. Olga Garcia-Lupshin, and I'm going to be discussing running the healthy way. Running is a great form of exercise, and whether you're training for your first 5K or you're ready to go out and train for your very first marathon, I have 5 healthy tips for you. One of the most common foot injuries that a runner can have is called plantar fasciitis. How this occurs is that the fibrous ligament that runs on the bottom of the foot from the heel to the toes can get inflamed. So when it's swollen and tender, it can be very painful when you first get up in the morning after you've been resting or while you're running. So we need to prevent it. How do we prevent this? Stretching is the #1 thing you can do at home. Stretch after you've warmed up, stretch during the day. Take an anti-inflammatory if this pain occurs. Now, if you come in with plantar fasciitis, we're going to check to make sure that you're not getting a stress fracture in your calcaneus or the heel bone by an x-ray. The second thing we're going to do is evaluate what type of shoe you're wearing, because you may not be wearing the adequate shoe for your foot type. Then we're going to move on to starting you on a stretching regimen and putting you in a night splint, which will help to stretch out that plantar fascia while you're sleeping and resting. Additionally, you may need a supportive insert in your shoe to take the stress off that ligament. Another common injury is called Achilles tendonitis. The gastrocnemius muscle, or the calf muscle as you know it, ends at the heel bone, in the back of the heel bone, as the Achilles tendon. When this tendon gets swollen and inflamed, it can become very painful when you're trying to run. How do you prevent this? Again, stretching is the most important thing you could do. Making sure you're wearing a very good, comfortable running shoe that's adequate for your foot type. Now, if you do have this problem, what your podiatrist may do, in addition to evaluating your shoes, is start you on an anti-inflammatory, have you ice the area, continue stretching, using a night splint. We may need to do an anti-inflammatory type injection known as Traumeel. We don't ever want to administer cortisone directly into the Achilles tendon, as that can weaken your Achilles tendon and lead to possibly a rupture of the tendon. Some patients need to go into a boot called a cam walker boot to immobilize temporarily the area. Burning, throbbing balls of your feet, that's called a Morton's neuroma, and that's a third problem you might be experiencing. Initially, you want to make sure your shoe fits properly, that it's not too tight in the toe box, because this can actually squeeze those nerves in the ball of your foot, leading to a pinched nerve. Now, if you have this, ice, rest your foot, take an anti-inflammatory. Your podiatrist will evaluate your shoe again to make sure it is the adequate shoe for you. Might even need a little cortisone anti-inflammatory injection in the ball of your foot for that inflamed nerve. Stress fractures are exactly what they sound like, repetitive force, meaning repetitive stress on that area. It can occur in the bones of the foot, it can occur in your leg also. Now, if you aren't adequately changing out your shoes, and remember, your shoes should be changed out about every 400 to 500 miles, you may be wearing out the shoes to the point where you're getting too much pressure on these areas and too much stress. And you'll end up with a swollen area that upon x-ray we'll see a stress reaction in the bone. How do we treat this? Well, you're going to need to rest it, you're going to need to elevate it, you're going to need to ice it, but very importantly, we're going to need to immobilize. And you may very well likely end up in a cam walker fracture type boot for about 8 to 10 weeks. The last type of problem you might be experiencing are called shin splints or tibial stress syndrome. What happens in this case is runners of all ages can have discomfort and a pulling sensation in the area of the shin bone. Now, how we can avoid this is to make sure that you're stretching adequately, wearing the proper type of shoes, and taking anti-inflammatory medications. Now, at the Gentle Foot Care Center, we want to keep you running, we want to keep you exercising, and we want to keep your feet, ankles, and legs as healthy as can be. So if you start to experience any discomfort, we need you to back off with the running, get checked out, bring in your shoes so we can evaluate them, so we can get you right back on your feet.